Hello, my name is Brianne Justian, and this is my presentation on bipolar disorder. Bipolar disorder is a mood disorder that makes a person vacillate from emotional highs to depressive lows. These moods come in extremes and can last weeks or months, and they can be rare or happen multiple times in short succession. There are three main types of bipolar disorder: Bipolar 1, Bipolar 2, and cyclothymic. The first type is Bipolar 1. To be diagnosed with this type, an individual has to have at least one manic episode before or after a hypomanic or depressive episode. To have Bipolar 2, an individual has to have at least one episode of major depression and one of hypomania before they can be diagnosed, but not if they've ever had a manic episode. The last type is cyclothymic. This bipolar type is when an individual has suffered many periods of hypomania and depression symptoms for at least 2 years, or 1 year for adolescents. There are two major symptom categories in bipolar disorder: manic symptoms and depressive symptoms. This infographic shows a few of the general signs and symptoms, and a few others are rapid speech, grand levels of self-importance, such as knowing a celebrity, your brain feeling blank, as well as seeing or hearing things that aren't there. The earliest known mention of bipolar disorder was by the physician Hippocrates, who was the first to document the two extreme moods: feeling extremely low, what he called melancholia, now known as depression, and feeling extremely energized, now known as being manic. He thought that the lows were caused by too much black bile, the literal meaning of melancholia, and the highs were thought to be caused by too much yellow bile. Bipolar disorder affects all aspects of an individual's life, especially work, relationships, and drug and alcohol abuse, just to name a few. Unpredictable mood patterns and possible manic episodes are hard on every relationship, from friends to family to romantic partners, never really knowing where the bipolar individual stands with their relationship. For work, a person with the disorder can either be extremely productive or unable to get up the energy to even get out of bed to actually get to work. This leads to struggles in the workplace, with doubts of the individual's productivity and reliability. The connection between bipolar disorder and drug and alcohol abuse is apparent, as bipolar is a mood disorder and the addictive substances naturally affect moods. If a bipolar individual is feeling extremely depressed and or unmotivated, they might turn to drugs and alcohol to feel normal or good again, if only for a little while. The actual cause of bipolar disorder is unknown, but it is overall agreed that multiple factors play into it, including biology, specifically genetics. Bipolar disorder is considered to be one of the most inheritable disease mental health conditions, with research suggesting that genetics accounts for 60 to 80% of the cause of the disorder. The table here shows connections between familial factors and the chance of inheriting the disorder. Symptoms listed in the DSM-5 criteria have to last for at least a week, continuing nearly all day, every day. According to the American Psychiatric Association, to be officially diagnosed, an individual must meet 3 or more of these symptoms. A few of the listed symptoms included a lessened need for sleep, extreme feelings of importance and self-esteem, unattainable plans or ideas, and fast or continuous thoughts. Though not as prevalent as autism or other disorders, bipolar is still shown in movies, shows, and even comics. The most well-known bipolar character is perhaps Patrizio Pat Solitano Jr. from Silver Linings Playbook, played by Bradley Cooper. Pat is a man diagnosed with bipolar and shows many symptoms of the disorder throughout the movie, such as severe mood swings, periods of sleeplessness, and grandiose ideas of getting his wife back, even though she has a restraining order against him. Though Silver Linings Playbook does put bipolar disorder in the public eye and is an adequate representation of the disorder, the film still falls into harmful stereotypes. A major one is the character's tendency of violence, where anger and unpredictability is one of Pat's main characteristics in relation with his bipolar disorder. He starts out in a mental hospital for badly beating his wife's lover, and in one of his manic states later in the movie, attacks his mother and father when they try to calm him down from an episode. This behavior shows to the audience that people with bipolar are volatile and dangerous, and that they always resort to attacking those around them when upset. This, of course, is not the case. Unfortunately, bipolar disorder is a lifelong illness with no definite cure, but the symptoms can be suppressed and treated. One possible treatment is cognitive behavioral disorder. Therapy. This therapy focuses on the patient's thoughts and emotions, and how that patient can learn to understand and control them. There's also family-focused therapy. This therapy involves the patient's parents, friends, or caregivers to help improve communication and problem-solving skills, though it is usually reserved for children and teens. Another treatment is medication. Psychiatrists usually prescribe mood stabilizers to stabilize manic episodes, antipsychotics that help with both manic and depressive episodes, and or antidepressants to help with depressive episodes. There are ethical considerations in every profession, but especially those dealing with the mentally ill. One consideration is treatment over objection. This is when a patient is refusing treatment but is a danger to themselves or others. If that is the case, the mental health hospital or psychiatrist may request permission to administer treatment over the patient's objection. Another consideration is being fully transparent with the risk of treatment. A patient has the right to know any drawbacks or side effects any medication has, and therefore the opportunity to refuse it. One last ethical consideration is the patient is a pioneer. Depending on the mental and chronological age, a psychiatrist may have more or less confidentiality with their patients. Some jurisdictions permit full confidentiality with an unemancipated minor, while others do not grant the decision-making authority. These are my sources. Thank you.